Shigella is a gram-negative, facultative anaerobic bacterium responsible for causing shigellosis, an infectious disease that primarily affects the human gastrointestinal system. It's highly contagious and typically spread through the fecal-oral route, often due to inadequate sanitation, contaminated water, or food. The infection is particularly common in crowded environments, such as daycare centers, prisons, and areas with poor sanitation. Shigella can also be transmitted through direct contact with an infected person's stool or contaminated surfaces. The bacterium is often associated with outbreaks in developing countries, but it remains a global concern due to its ability to spread rapidly in settings with compromised hygiene. Clinically, shigellosis presents with symptoms such as diarrhea, which can be bloody, abdominal pain, fever, and sometimes vomiting. In severe cases, the infection can lead to dehydration, dysentery, and even more serious complications like hemolytic uremic syndrome, or HUS, in children. The severity of the symptoms often depends on the strain of Shigella involved, with Shigella dysentery being the most virulent and associated with the highest mortality rates. Diagnosis of Shigella infections involves stool culture and molecular techniques such as PCR to identify the pathogen. On McConkey agar, Shigella colonies are non-lactose fermenting, appearing as pale, colorless colonies. A gram stain reveals gram-negative rods. Biochemical testing also plays a role in identification. Shigella species are oxidase negative, catalase negative, and typically non-motile. Additionally, Shigella species can be distinguished from other enteric pathogens through their inability to ferment glucose and their production of hydrogen sulfide. Treatment of Shigella infections generally involves fluid and electrolyte replacement to manage dehydration. In cases of severe infection or when symptoms persist, antibiotics such as ciprofloxacin, azithromycin, or ceftriaxone may be prescribed, depending on the strain's susceptibility. However, the rise of antibiotic resistance in Shigella strains is a growing concern, particularly in areas with high rates of infection. As a result, resistance testing is crucial for determining the most effective treatment. Prevention of Shigella infections primarily focuses on improving sanitation, promoting hand hygiene, and ensuring safe food and water practices. Vaccines are under investigation, but as of now, there is no widely available vaccine for Shigella. Shigella continues to be a significant public health challenge due to its ease of transmission and the emergence of antibiotic-resistant strains. Understanding its transmission, clinical presentation, diagnostic methods, and treatment options is crucial for healthcare professionals and biomedical scientists working in the field of infectious diseases. This lecture is for educational purposes only and should not replace professional medical advice. Follow and subscribe for more lectures in microbiology, infectious diseases, and ancient remedies.